Today, my guest is Dr. Richard Marn. He is a physician and co-founder of a risk management company in the dental industry. They specialize in minimizing sedation risks, especially for children and teenagers. They've developed and are pioneering an emergency simulation workshop to enhance teamwork during emergencies. Over the last 2 years, they have successfully improved crisis response teamwork for over 70 dental healthcare professionals. In the next 3 months, he's launching an online scorecard to assess readiness for sedation emergencies. His vision is to bridge the gap between dental and medical emergency readiness so that no child dies in a dental or oral surgery office ever again. So Dr. Marn, thank you so much for the work that you do. First, I want to know how you got into this.
Pleasure to be here. Thanks for having me on. Please call me Richard.
Okay.
So how did I get here? I would say my wife told me so. She's actually a pediatric dentist. Her name is Jessica, same last name. She indicated to me, hey, there might be a need here because unfortunately there are some bad outcomes or near misses that are occurring in dental and oral surgery offices. And, I think it could really help this part of the industry. And she kind of encouraged me and kind of shed some light on it. And I didn't know much of it at the time. And so as I dived into it, that's where I started learning how notable the gap is, if you will, between the dental industry as a whole, especially private practice, dental and oral surgery offices, are in terms of their readiness for emergencies compared to definitely the best medical hospitals and how they prepare for medical events. And so I kind of got into it because my wife encouraged me. And then as I learned more about it, it kind of definitely fed into a little bit about who I was have always been as a kid, which was really was into medicine and trying to help people from a medical standpoint. And also I really enjoy teaching too. So it kind of led into this this education and risk assessment, risk management industry.
That is awesome. And I like you said, I think your wife was correct. It is something that is needed. Being a dental hygienist for over 35 years, I think there's only been one office where we actually did a mock emergency situation. Where's the oxygen and where is everything located and what is the response time after we had an emergency in our office, a diabetic emergency.
Yes.
And we called 911. And what I didn't know at the time was we had an ambulance placed right next door to our facility. But when you call 911, there is a location that is contracted for your location, which was 15 minutes across town.
Wow. Okay.
So then we practiced a drill that we no longer called 911. We sent our front desk person next door because if she went next door and said we needed help, they could come right over. But didn't know that till we had an emergency. So I think you are definitely on the right track of teaching dental offices and oral surgeon offices what to do in case of an emergency and have them be prepared.
I think that's the great thing when you actually do the stress test, if you will, of your team. It's when you do that, you uncover both the deficiencies but also the strengths of your team, and then you can work forward from that. If you don't even do that, there's just so many assumptions that you make, and so many of those assumptions can be wrong at the wrong time. And so having a way to stress test your team, or have someone come in and do it for you, because of course if there's an outside person that gives a professional outside perspective, that's a little bit more blinded to your assumptions, that can really help. And look at that, you guys, because of that experience, you made a change. That just speaks to, even after those kind of near misses, that's one of the best times to do what they call a debrief, where you take your team, hey, let's talk about what just happened. And there's actually ways to do a debrief where it's very powerful, effective, makes your team feel included. And that's part of being a simulation facilitator and educator that teach a proper way on how to guide a team through those kind of events and how you can learn from them. Because you don't want to waste those events. You don't want to waste those times. This is funny, you mentioned the ambulance is right next door. Response time for an ambulance in New York City in 2024 is 9.5 minutes. That means, that's an average. That means on average, you're going to have to manage a patient for about 10 minutes before help will arrive. Okay. And that's in New York City. I've heard it in other cities like Atlanta, it's almost 30 minutes, but you really want to check what your response time is in your office. And what are you going to do in those 10 minutes? Right. And so that's a lot of time where you have to, you and your team need to know how to perform and function during very critical minutes when someone's life may be really on that line. So I think it's just funny that we have these assumptions of, oh, there's an ambulance next door. They should arrive any second we call them. Not necessarily true.
No, not true at all. And it, like you said, I think it took them 11 minutes to get to us. And, for us, it was lucky that it wasn't a patient. It was actually one of our team members.
Mm-hmm.
So we had everything we needed in the emergency kit. But I think a lot of times people don't even look at their emergency kit to see that things expire. We were just prepared for that. But yeah, some offices that have gone in don't even have emergency oxygen separate from like everything else that they can't just wheel to the patient. So that's all.
I've worked in over 40 dental and oral surgery offices. Most of them don't have portable oxygen. No. And so for me to do sedation in their office, because that's what I do clinically, right? I'm a pediatric anesthesiologist. I go to dental and oral surgery offices and I specialize in sedating kids for those procedures. And when I go to every office, I have a checklist that I go through to make sure that they have these basics before we can even consider doing sedation. And I would say anecdotally, about half of them do not have portable oxygen. And even if they do, they certainly don't know how to use them. It is unfortunate, but it's simple things like this that we make assumptions about what an office should have. And it's a scary thing to make that assumption.
Yes.
So that's why having simulation, having mock drills, kind of having table talk exercises just for something as simple as this will make that real event much more safer, much more effective, and much more hopefully pleasant and with a better outcome. When you look at medical emergency readiness, there's like 4 pillars to be prepared. And the first one is what we call infrastructure. So infrastructure is medications, equipment, supplies, visual aids, ingress, egress, how do you even have the basics, right? And so it reminds me of this story and you talking about how you had expired meds, reminds me of the story of this patient. It's a 70-year-old woman. I did not take care of him. It was a story where I was told about this from a friend in the dental industry, and they were present for a medical emergency in an oral surgery office. The emergency took place. It was the patient apparently had oxygen got very low. Unfortunately, the oral surgeon literally froze and kind of didn't know. From what I was told, just kind of stood in the corner. Fortunately, there were other oral surgeons in that practice, and they came and kind of rescued the situation. But she said, as she was listening to the surgeons kind of manage this emergency, and it was very chaotic before 911 even came. And by the way, 911 went to the wrong door. They didn't even, so they were delayed in getting there. When they look at the medications, they said out loud to themselves, these medications are expired. And so here, a facility in New York City, in a multi oral surgery practice with good repute that I understand, even they were not really quite prepared for that event on a 70-something-year-old lady for a procedure. I heard the woman got to the hospital successfully. Thank goodness. That's what you call like a near miss. They must have done something enough to get them through that, but it was such a hit to the morale of that practice and the people that day that even though that case started around noon or 1 o'clock, the practice manager and I think the oral surgeons said, hey, you know what? We'll just call it a day. Canceled all the cases. The whole team was shell-shocked by this very stressful and emotional event. And that's literally because you weren't prepared. You lost thousands of dollars out the door.
Yeah, and your whole team is in fight or flight now, right?
Yeah.
So,
Yeah. So it's not benign. It has an effect on the patient, but also the people around her family or the staff. It's what they call the second victim. The people taking care of that victim has a second victim impact where they themselves are impacted by it negatively, usually because of that near miss in someone's health.
Yeah, that's crazy. So what's the second pillar then?
So the second pillar is what we call competency. does a team, not just a dentist, oral surgeon, but does the whole team, the whole office know what to do? Are they competent in their roles? Do they even know what their roles are? It's more than just BLS. Like a lot of people say, oh, I'm ready for a medical emergency because I have my BLS or ACLS or PAL certificate. There's a few drawbacks to making that statement. One, it implies that that's enough. Number two, most people just do the basic, which is meaning they just do compliance, which is, well, I just do it every 2 years. And we know that skill degradation breaks down within about 6 weeks to 3 months.
Mhm.
I actually went to a recent national simulation conference. They were testing paramedics somewhere in, I think, Virginia state. And these doctors and studied these paramedics, veteran paramedics, about, okay, we're going to train you on tracheostomies, right? Emergent tracheostomy. And then we're going to get your, assess your behavior and confidence right after they did a pre-test and a post-test right after that training on that same day. And then they tested them 6 months later. And they found that their ability to do tracheostomy was no different than right before they learned how to do the tracheostomy. That means that they learned a skill. It was good for that. They got really good at it within that day, and their confidence level was really high. But somewhere between that afternoon and 6 months later, their level of competence and ability to do that skill broke down notably within 6 months. That was back to baseline. So there's enough evidence that shows from a skill standpoint, you really got to do as much repetition as possible, ideally every 3 months. Definitely, there is a lot of data in the simulation and medical simulation world showing that. So competency is, do you have the right skills? Do you have the basics like BLS, ACLS, PALS? Do you know how to use the equipment that you actually talked about in the infrastructure, which is the first pillar? Does your team know how to use it, right? And do you actually know how to communicate as a team during those emergencies as well?
Yeah, and that's interesting that you bring that up because I also teach CPR, I teach BLS, I go to offices and teach, and they don't cover first aid emergencies. It's a completely separate course. So BLS just covers AED, adult, infant, child CPR. And
Yes.
so it doesn't put everything together. It's a totally separate class if you want that.
It's a very vital skill, no doubt, but it not every emergency requires BLS. And in fact, there are things you can do so you don't get to that level because you don't want to be in a state where you have to actually do BLS. I don't remember the numbers, but the out of hospital arrest survival rate past 30 days is actually quite low. All right. And what I mean low, I'm not talking about less, just around 50%. I want to say 10%. So again, don't quote me on this exactly, but it is not an impressive number.
That is correct. Less than 10% of patients survive a emergency situation, mostly because bystanders don't start CPR within 4 to 6 minutes. So if someone goes down and they have no pulse and no breathing, if you don't start CPR in that 4 to 6 minutes, 10 minutes if there's some other situations, but usually the ambulance doesn't get there in time. So that's why they're trying to train as many people as possible to start right away, because less than 10% actually survive that and get to the hospital unless someone starts CPR right on site or addresses the emergency situation.
Sure, you just identified a big hurdle for a lot of people, not just lay people, but even doctors and dentists and oral surgeons. Starting therapy, starting treatment is a big hurdle. First of all, recognizing that you have a problem and then actually acting on it. A lot of people don't want to believe that there's something really bad going on. And so they delay activity like BLS, for example, or recognizing that there's an asthma attack, or recognizing there's an aspiration, or recognizing that you actually have an apnea going on, or like just an emergency. Like, oh, that set can't be 80%. No, maybe there's something wrong with the waveform and they're fiddling with the pulse oximeter when really that's really 80, you know? And so that's a big, unfortunate hurdle that we as humans, it's not just doctors, not just nurses, not just hygienists, not just dental assistants. It's people in general have to get over, like, there's recognizing there's a problem and then acting on it. I'm going to kind of hit home on this. If you do training, you're able to lower that hurdle to act sooner. And that's why, as you mentioned earlier, that I'm a big proponent of simulation and training as a team.
Yes. Yes. And I think we definitely need more of that. So you are in the right spot. Kudos to your wife for pushing you in that direction. Tell her thank you.
She was definitely right.
She was. She was. So let's go to pillar number 3.
Oh, so pillar number 3 is what I call culture. So I think there's a lot of data that already supports how a strong culture creates a stronger team. But the idea is your team actually aligned with your goals? So if you don't talk about like emergencies, your team won't. If you don't address it as a leader of your team won't make it a priority either. So where are you in creating a culture where safety is really priority number one? I mean, look, every anesthesiologist in this country, across the world, every practice owner, every dentist, every oral surgeon, anybody, most people in healthcare are going to say, oh, health safety is priority number one. Mm-hmm. But do they actually act on it? Do they actually create a culture that really believes that, right? I would say part of the challenge is emergencies are what we call halo events, right? High acuity, low occurrence, HALO. And so because it doesn't happen that often, a lot of people think they have these misconceptions. When I say people, I'm usually implying dentists, oral surgeons, dental practice owners. They often think, and not, it's very natural to think this way, but they often think, oh, it's not going to happen to me. Or, another misconception is, I know BLS, or I know what we'll do. We're not going to panic. Don't worry, I'm a doctor. Unfortunately, ego gets away in some people's way to learn and make changes. And another misconception people have is 911. We'll just call 911 and they'll show up in time and they'll take care of it. And as we talked about, that's not necessarily the case. So there's all these misconceptions within the dental industry that lead people to think, oh, these halo events probably won't affect me, and we're ready for it, and probably don't do much about it. And so therefore, it doesn't become part of their culture. And so having those kind of conversations where just talking about the topic and bring up to your team, because you'd be surprised how many people that are not dentists that work in dental offices see the deficits that dentists and oral surgeons do not see. It is fascinating. When we do our workshops, the aha moments, the light bulb moments often come not from necessarily the dentist or the oral surgeon who necessarily hired us to come into our team, but because we create a setting and ask the right questions, it allows the team to reveal oh, wow, this is what we should do instead, or here's some deficits. I never even noticed that before. Mm-hmm. And it engenders a sense of teamwork and therefore culture that makes people say, wow, we can have an impact. We can have a role in helping keep that patient safe. And so culture, I think, is a huge important part, because it shows that you're prioritizing that as an important aspect of your business.
I agree. Absolutely. So let's go to pillar number 4.
Oh, all right. So number 4 is habits. Do you actually have habits that actually create a safe environment? So a lot of offices will just have equipment and supplies, and very much so. My wife's office was just like this as well. What do the habits look like? Well, do you have huddles? Do you have huddles that specifically talk about this before and after, at the end of the day, whether the day goes well or not? Do you have huddles to talk about a near-miss event, right? Do you actually designate somebody on your team that is like your safety officer, and they can keep track of making sure all those other 3 pillars are in line? Are all your medications, equipment, supplies, visual aids, your infrastructure, are they all not expired items and it's ready to go and people want to use it? Do you basically make safety a daily part of your life?
Yeah.
That's what habit is. So it's top of mind. It's not back of mind. It's not at the back end of the line. Is it really top of mind? So those are kind of the 4 pillars: infrastructure, competency or competence, culture, and habit.
And you're right. They are amazing. And I think we talked about it once a year. I temped for 7 years. And so went to different offices almost every day. And it wasn't something that was brought up, but most people do not talk about it. It's not a habit to talk about just on a day-to-day basis.
You can even just start with, if you're a dentist, if you're an oral surgeon, you can just start with, hey, does everybody know where our emergency kit is? Okay, why don't we go get it and open it up? And you'll be surprised. A lot of these offices I've done the training at, or even offices I actually do sedation at, you open the kit and it's never been opened before. Some of it's not even out of the packaging. And literally in the training, they're, all right, how do we give this? And they're reading the package insert of how to administer something, whether it's an epi or albuterol or how to do a glucose check. They've never used it before, or even their blood pressure cuff. They've never even taken it out. And these simple things that we assume we know how to do come to light when you actually go through those little exercises. So, take out the kit, go through it as a team. Where is everything? Does everybody even know what this does? Because remember, in emergency, often the dentist will probably be attending to the patient. So you need to depend on your team to know where to get the kit and how to bring it to the dentist, how to open it up. If the dentist asks for a certain drug, do you even know what to get? Do you know what to look for? Do you have the right dose? These little simple things that, again, we take for granted. And when it comes down to it, you lose time. Time is of the essence. There's organizations that say you have 5-minute window. I believe you literally have 30 seconds. Every 30 seconds you start acting, because that first hurdle is a big determinant of where the rest of the outcome, where the timeline is going to lead you. So simple things like literally taking out the kit as a team, I think is a great start.
Yep, I agree.
Every minute of not getting oxygen to your brain, if I recall, leads to the 10% death of brain cells, something like that. So it happens quickly.
Yes.
It happens very quickly. And also I would have mentioned, there's another thing that I've picked up from one of my mentors. He would say, when emotions go up, intelligence goes down. And so I think that's very relevant to a lot of things in life, where, when your patient is not doing well, your emotions naturally go up. I think that's normal for a lot of people. And therefore we don't think as clearly and we don't perform as usually as we expect. And therefore you can have bad outcomes and people suffer because of that. And so training helps to modify, or at least better control those emotions.
Yeah, it's again, it's in fight or flight. And when you're in fight or flight, you start breathing shallow instead of breathing through your diaphragm. So that person is getting less oxygen to their brain. So 10% when you start in fight or flight. So that's why that goes down, because it changes your breathing as well. So your sympathetic nervous system gets activated, and so you're not thinking as clearly because you're kind of just in a fire situation. What do I do? What do I do?
And it's true. And you know what? Even if you look at the best teams, Cherie, like if you look at the best teams, the best industries where safety is really important, there is a common thread, right? It's not like, hey, you have to read this book, or, we have to have a lot of meetings. It's they practice, and they practice with someone that often guides them. So if you look at the nuclear energy industry, you look at the aviation industry, you look at the best military teams like the Rangers or the Navy SEALs, they're always practicing. They're always practicing because their lives are actually on the line, as well as other people's, of course. They don't know what they're doing. And it's not like we're having all out bad events all the time. They're practicing for those rare events because real people's lives matter. And quite frankly, Cherie, I'm sorry, it's not only the patient's lives, it's the lives of the people taking care of that child, whether it's a hygienist, dental assistant, and the dentists themselves. Their practice reputations online too. And it's surprising to me how much is at stake, and people still don't take the steps to get to where they need to be ready for those kind of halo events.
Yes. And I think that's why a lot of parents are now questioning, does my child need to go under anesthetic? We were talking a little bit about that before we came on, especially tongue tie. You talked about you had a tongue tie release. I've had a lot of parents say, do they need to be under? I know Dr. Zaghi at the Breathe Institute doesn't like to put them under because he wants them to be able to make that suction so he can see what's happening. So again, it's going to depend on the provider, what they prefer. Some providers prefer to put people under, some don't. So it's a matter of finding a provider that's in the same mindset that you are too.
Agreed. It's totally reasonable as a parent to ask questions. I think a lot of parents making sure that you feel comfortable with that doctor
Mhm.
is number one, right? There's a sense of that gut reaction. If your gut says, maybe not, then maybe you should kind of take a pause.
Yes.
1 day, 2 days, a week is not going to change usually that much often in most situations. So, taking a pause, like, let me reevaluate this. Let me see if I can find a little more people I can talk to. I'm not saying Dr. Google or ChatGPT is the best option, but,
Yeah.
talk with other professionals. It's not unreasonable to get a second opinion. Find the right person that you feel you can trust is I think, vital.
And I love that answer because I talk a lot about, as a parent, or even if you're the patient, always follow your gut instincts. They're there for a reason. And
Mhm.
and you are well within your right to question if that's what you're feeling. So your instincts are usually never wrong. So I love that you put that out there.
Yeah. And I tell parents, listen, I want you to feel comfortable with me taking care of you and your child. I may not be the right person for you. This is how I make it easy for parents.
Yeah.
I tell them, listen, I want you to Google the heck out of me, right? Because I want you to know who's taking care of your kid. I want you to feel confident about that. And if you have questions, I want us to talk about it, all right? And I want to explore all the options. Because usually when people come to me, I want to make sure that if I'm the option last resort, that they have the best option and talk about that. Because sometimes there might be other options that we haven't considered. If you're going to have me take care of you, I will tell you, you're going to get the same, if not better care than you do in a hospital. You're not going to get a resident. You're not going to get some rookie. You're not going to get some part-time anesthesiologist that dabbles in this. You get someone that really does this and knows it and has been doing it for quite some time. And not to say that something can't happen, but let me tell you what we're going to do, what the steps are if we do run into a problem, and what we do as a team. And so all those four kind of pillars, I actually implement it in my own team. So when I go to dental offices, I do training of each of my clients at least every quarter. And we do little mock drills or simulations where I actually train the dentists, the oral surgeons, and or their team how to behave and act in emergency. I make that my habit of the people I work with. I make that a habit of myself and the people I bring on. Because when you talk about medical emergencies, people get very scared initially. They're like, oh my God, I don't want to talk about it. As if it'll never come around. It's like the boogeyman. If you say that, it's like Beetlejuice. If you keep saying their name, it's going to come up. No. If just because we talk about it doesn't mean it's going to happen. What it means is we're actually creating a culture and we're creating habits. If and when it does happen, we are going to kick butt and we're going to do great as a team as best we can.
Right.
And so it's about bringing awareness. I empower them. I say, listen, don't think I know everything. I may not see something you see. I want you to speak up. I'm giving you opportunity. If you see something that seems a little weird, like your gut's saying something's odd, to speak up. And I will tell you, because I help to provide that environment, in the past, when we had some sedation situations, people spoke up and I acted a little sooner because they saw something that I didn't see yet.
Yeah, I think this was phenomenal. You answered a lot of the questions that I had without me having to ask them.
Thank you.
You covered
Glad.
the things that I cover just naturally. So it was amazing. I appreciate you. And so if someone listening is a dental office, or you work in a dental office or oral surgeon office, and they want to get a hold of you to do this preparedness for their office, how do they get a hold of you?
For our risk management education training, they can reach out to us through our website, which is bpmedsim.com, which is Blue Pacific Medical Simulation. I actually like to encourage your listeners to consider doing this instead, for you to assess your own self where you are in the four pillars. So we developed an online scorecard where whether you're a hygienist or dentist or a oral surgeon or even a practice owner, or practice manager, you can actually just go through these questions. It's like 5 to 6 questions for each of those pillars. It takes maybe 5-10 minutes to do. And you can get an assessment. It gives you a score for each of those pillars, and then it gives you a cumulative score of where you are. It shows you where your deficiencies are, where your strengths are. And you also get a PDF report that gets emailed to you after you fill this out, giving you suggestions. on what you can do to improve in each of those pillars or cornerstones of medical emergency readiness, especially for sedation. And so that I think is a great tool. It's free. And we're in January here. We literally just launched it like a few weeks ago. And it's impressive some of the results and data that we're getting from the people that have completed it. And so I really encourage people to consider kind of just getting that going. It has my contact information on it, but I think it's a great resource just to give you an idea of where you as a practice stand in being ready for that emergency for sedation in your office.
That's amazing. And I will put the link in the show notes. So if anyone wants to get that, you can just click on that and go right to that and take that test.
Yes, it's emergency.scoreapp.com. But what I'll make sure to give that to you later on, Cherie, so you can put it in the notes as well. Okay. So it's easy to click on.
Perfect. So before we leave, I ask everyone this question. What is one thing that you want people to take away from this? If they only were to take away one thing from everything that we talked about today, what would it be?
I would say I'm really big into creating teamwork and building teams and knowing that your team can help you during those events. You don't have to Ironman everything. You don't have to be solo. And so I think bringing your team together. If one thing to do is just start talking with your team. Hey, what can we do to get better in this topic of sedation emergencies or medical emergencies in our office? What can we do? Because I hate to say, but dentists and oral surgeons do not have all the answers. I don't. And so lean on your team. They can help you out. And I tell you, you go farther with the team.
I absolutely agree. So thank you so much for your expertise, for sharing this with us, and for being on the podcast today. I really appreciate all of your information that you shared today.
My pleasure. Thanks for having me.